Thank you so much for that introduction, Neha.
It was very lovely. I don't know how you all felt, but we certainly felt like Dr. Nicholas covered such a wide breadth of information. It was really quite phenomenal. It really spoke to most of the research that Brady and I did as well in terms of seeing what was out there in the literature. He's really covered so much of that information that throughout our presentation today, we thought we'd kind of bring it down because he really covered it in such a macro level. We thought we'd bring it down to a bit of a micro level and talk about what we've been able to learn from our community at the Center for Autism Services Alberta. What we've learned from our families, from our participants, from some of our programs, and really try to give everybody some really specific examples to some of those really broad topics that Dr. Nicholas brought up, and give you that really focused lens and focused stories in what we've heard from our community. And then we thought we'd share a little bit of some of the steps our programming has taken and what we've seen in our community when it comes to strategies and in things that individuals have shared with us. So if you want to go ahead and advance the slide, Brady. Just as Dr. Nicholas said, there's been such an impact on our community as well. We've heard from self-advocates that are associated with us. One of the really immediate things, like Dr. Nicholas mentioned at the very beginning of the pandemic, was those disruption to routines. We had the opportunity to hear that individuals specifically suddenly had a lot more free time at home and were unsure how to fill that time, or they had difficulty readjusting to new routines when the routines that they had really gave them some of that structure and comfort in terms of living out their daily lives. So we heard really specific examples from some of our participants that was a real challenge for them. Some of the ways that we were able to support that, I can think of a really specific example with one of our participants where he reached out to staff and specifically asked to work on a timetable and a daily plan to be able to get through his day and deal with the changes and figure out what to do with his time while he was at home and not really able to go anywhere. So that was one really specific type of event that happened in regards to disruption of routines. We've heard so much about the disruption of services and supports. The way Dr. Nicholas described it as there's so many supports and services that are accessed. And one of my families, and I believe they're on this, have joined the conference as well, really talks about it taking a village. And I love that saying because it's so true. So when pieces of the village have disappeared or have become inaccessible, and those demands on families have increased, families have had to be really creative in terms of how to access their village again. And we've seen some really specific examples around that I think we'll be able to share as well. Without a doubt, the increase in stress has been incredible on everyone involved, specifically with our autism community. We've noticed that the stressors have really affected engagement and participation. Some of the things I've heard from our adults is, they've really had to take a step back and really just focus on their own self-care. And they were really unable to participate in other areas of life that they normally would. One thing I wanted to really highlight that came about from some of the research that I did is that, autistic women, adult women that are independent and living on their own seem to be disproportionately affected by the pandemic as well. I think that's just a really important point because it really draws towards Dr. Nicholas's point of the vulnerability and that added vulnerability of being an autistic woman and being affected in your home life, in your employment, and having that women reporting that that is really affecting them more, I think is a really important point to make as well. Um, one of one of a quote that I came across in a study from the UK that I think really stuck with me because we see it so specifically in our community as well is, and I'm just going to go ahead and read it, is that the stress of not being able to see loved ones outside the home and feeling crippled by social isolation with no idea when it'll end. I feel a neurotypical person in this situation will have a vast number of people to interact with in varying ways. I have two who I'm in touch with outside my home and only one via Skype. As an autistic, I have a limited social circle and now it's even smaller. I worry about autistics who live alone consistently too. This quote was just really important to me because I think within our own community, we've really understood how the isolation has affected our participants with lockdowns, coming and going in waves of opening and restricting again. We've seen that need for in-person and community support is just huge. And some of our participants are able to actually express how important it's been to them to be able to see and be with their friends and have that peer support that Dr. Nicholas is finding to be so important. And very specifically, we're finding the exact same effect amongst our participants who learn together in a group. The excitement of seeing each other, the ability to be able to be in a group again is so important to them. And many of them have been able to express how much they have missed that. And at the same time, really talk about how there's also that anxiety to come back and be together again because they're needing to practice skills that they haven't had to practice in over a year. So really thinking about how we do bring everyone back together in a real gentle and safe way. We certainly are sensitive and careful and really cautious in thinking about what the mental health impacts have been. We've heard from so many of our adults that they're feeling an increase of anxiety and fear. Some of that is resulting in them really putting a hold on their goals, for example, for employment. Some individuals, though, honestly, have really demonstrated quite a bit of resilience, and we'd like to share some of those stories of challenges and resilience. Some of our adults have been able to continue their education during the lockdown. Some of them have very specifically been able to find and pursue employment. So there's been a lot of resiliency in our community and as well as the challenges. And Brady and I are hoping to share a number of those kind of specific stories with you today. I'll turn it over to you, Brady.
Thanks, Eva. Let me just flip over to the next slide there. Okay. So yeah, to echo Eva, Dr. David Nichols covered a lot. And looking at the Edmonton community and the Alberta community, we're seeing a lot of what the research is telling us and what we're seeing in our own community, that there's both strengths and weaknesses to this dramatic shift of digital access and programming. on one side has made experiential learning for everyone significantly more challenging. Because like, how do you conduct and connect and support someone when all you've ever been taught are these in-person strategies, and there's not a lot of evidence to support and research done to support the telehealth stuff. But here we are, just kind of thrown into it and having to figure it out and reinvent it. So hopefully, more research is existing and will continue to exist to kind of support these blended delivery services. So as service providers, we've had to reinvent like everything. And so have schools, and so have most grocery stores. Everyone's had to reinvent everything. But this is also really creating a unique opportunity to collaborate more than we ever have before. So with everyone starting at square one, now everyone is also sharing their ideas and their resources. There was a little bit of that before COVID, but now there seems to be an influx of agencies coming together and just sending information. They're like, look, we've got these visual aids that for different age groups that explain what COVID is, and they're just sending it out free. And that is a fantastic thing to see in any community, because that's what creates really strong communities and helps remove some of those barriers. So that's a really great pro that we're seeing, is the sharing of information. But we're also seeing quite a mix of hardship and thriving as we move to these digital platforms with people staying at home. One teen that I have in a bunch of my programs told me that she's been begging her mom for years to be homeschooled. And unfortunately, it wasn't possible because mom had to go into work every day. But now that mom's working from home and school gave that option for online, she joked with me saying that all it took was a global pandemic to get what I want. But she's really happy and she's thriving doing online schooling because it's something that she thrives on, and she loves independent study, and it works well for her learning style. And mom reports that her grades have been better than ever before. So that's a really great example of what we're seeing with people thriving with this new online telehealth stuff. On the other hand, people are now stuck at home and not having that differentiation between home and school and work and friends. It is all in the home now. And we have another adult who is an example of having a really hard time engaging in programming from home, because now his two spaces aren't separate. So he was doing really well attending in person and having that location and that program that was his. It was his thing. It was something he enjoyed. It's something he loved to engage in. And his parents were kind of on the other side. Like they supported him getting to these programs. But once he was there, it was him, and the focus was on him, and that was really important. Whereas now it's blended with home, and he's at home with his parents who are supervising and breathing down his neck as he's trying to engage in these programs. And it's really difficult when that one-on-one attention isn't available anymore, and it doesn't make the program feel very special or unique, or like you have ownership in it. And that's a huge challenge with this move to telehealth and blending these environments. When it comes to, we're also kind of seeing, when it comes to the online telehealth, another pro is a kind of reduction in that geographic disparity. So I'm seeing a lot of families from outside of Edmonton inquiring about services and signing up for programming because now it's more accessible. So I've got families down in Medicine Hat. I have 2 families in Medicine Hat that are doing my art club this afternoon. I've got a family out in Provost, and one in Fort McMurray, and one in Grand Prairie that are all kind of joining in on my social nights that we offer at the center. Um, and that was a really cool thing to see, that we're now making programming more accessible to other people and other locations that didn't have access to these things typically, because a lot of these services kind of center around major hubs like Edmonton and Calgary. There isn't even a lot down in Red Deer, which is a pretty significant city, or Lloydminster, um, which is really opening our eyes as service providers about what is actually around and available. So this is encouraging, because it when we're looking at this kind of programming, now that we see we've had to like force ourselves through learning and figuring out how to deliver these kinds of services over a blended of environments and medias. It's something we want to do going forward, because we can extend our reach and we can extend our support and our help as much as we can. So for us anyways, I can speak for the center that the telehealth piece isn't going to go away, but we're going to need to be more creative. And it won't be a fit for every program, but some it'll be an excellent fit. So we're looking to the future to see where it's a really great idea and a really great fit to kind of keep these blended options open, and where it just makes a lot of sense, so we can like maximize our reach and make sure it's accessible. What's also
Yeah, that's
really, oh, go ahead.
sorry, Brady. I was just going to jump in there with an example from our pre-employment program, and we're seeing very much the same as we're able to get those rural individuals accessing our program because it's online now, and it's typically been very focused in Edmonton. So it's been just amazing to be able to see people join from other communities because of the online. So similar in our pre-employment program.
And Eva's even been able to find work experience that is digital and online. So when they go forward, they continue to offer that in-person piece still digitally and remotely. Something else that's been really great with the telehealth is individuals that experience severe social anxiety now feel safer and more comfortable to participate in programs, because they can now do it from the comfort of their home. They can turn their screen off. They can mute and unmute their mic when they're comfortable, and they can use the chat if they want. It just creates so much more ability for people to participate in and engage, which is wonderful. When it comes to routines, we knew that the drastic changes to routines was going to be immensely impactful on the autism community. It's really easy for us as service providers to say you need to create new routines, but it is far more difficult to put that into action, especially when there's so much uncertainty. So we're in a time where everything changes week by week, or sometimes even day by day. So how can you possibly plan to have the best routine when you don't have all the information, or what information you do have changes at an alarming rate? So we're acknowledging those challenges, and we'll offer support where we can. And it's often just having understanding that this is hard for a lot of people, especially populations that are already vulnerable going into this. It's become exceptionally more difficult. And we need to make sure that we offer space and room for that, and for that adjustment, and some understanding when things aren't getting done, or when they're not getting done on time. Time is completely not a thing anymore. So that's something that we hope we can. I know there was questions at the end of the last session about that understanding carrying forward, and that's something that we've seen, and in some cases gone, oops, we didn't really realize this. So it's been a really good, excellent learning experience that we need to carry forward and continue doing, and making sure that messaging, that detailed messaging is available for those that want it, need it, and available easily and accessibly. So it's not, someone doesn't have to ask for it. It's just there. So I super appreciated that comment in the last section. We also, something that we didn't really predict about the chaos around routines was the impact it would have on self-determination and independence, especially on our teens and young adults that have worked really hard to kind of build those skills. Many of our adults are reporting a significant reduction in their independence now that schools are closed and public transit isn't as accessible now, or maybe there's one shared vehicle at home. So now parents have to drive everyone everywhere so everyone has access to that. We have one of our adults attends Grant McEwen for school. She's been going there for just over a year now. And she's expressed kind of the grief and unsettling feelings about that loss of independence now that her mom has to take her to school and pick her up, whereas before she was able to like just hop on a bus from anywhere in the city and go when she needed to go, and was managing that really well on her own. And that's a huge sense of loss for people that have worked really hard to gain that independence, and feel really proud about that that skill that they've kind of worked, and it just kind of taken away like that. And that's a difficult thing, and that's something that we do honor and acknowledge, that's hard. We have seen some incredible resilience emerge as well. The autism community is advocating for spaces and programs that will help them to maintain their social connections, which is something that's really quite fantastic. Out of all the programs that I've offered this winter, my social nights were the first ones that filled up and filled up quickly. And I even had to expand them a little bit just because there was that desire to keep connected with their friends and the people that they know and enjoy, and just having that break every once in a while that's not school and not home and not family, just with other people where they can connect with others and just have some fun, even though it's online and still exhausting online. It makes it a little bit better when it's something that's different. So we're hearing a lot of appreciation for that kind of support to like help maintain those social connections, which are really important when we're going through hard times. Though there's some really great positives and opportunities coming out of this, we're also seeing an increase in mental health crises. A lot of this is extremely difficult to navigate, especially for those that have entered COVID already more vulnerable, like we've all been saying. And that removal of the independence, amplified isolation, or being trapped at home where it's maybe not the most supportive environment, it's creating a lot of extremely heightened anxiety. And researchers and clinicians are starting to see symptomology that's very closely linked to acute stress disorders and PTSD. And that's something that we're going to have to keep into consideration now as we transition through the next phase of COVID, now that there's vaccinations and there's a little bit of a light at the end of the tunnel. We need to start thinking about these things because there's going to be long-term ramifications to all of what's going on, which we need to be mindful of and have room for. So as family members, friends, service providers, and community members, we're all going to need to be more mindful, more than ever, through the next phase. So much like transitioning into the pandemic was extremely bumpy, transitioning out is going to be just as bumpy as well, because now we've adjusted for a year and a half. It will go on into the fall. That's a long time to be in a pattern and then just be expected to abruptly change back to whatever normal is. And I think those expectations are not great, and they're not going to be conducive for anyone, especially those that are experiencing more difficulties through the pandemic. So we as service providers and families and friends need to make sure that we have those mental health supports in place and ready to go for either now or as we start to transition back. We're going to need to provide more time for adjustment. It's just going to take time. And I just have this gut feeling that a lot of people are going to want to just snap back into it But that's going to be so jarring for everyone. And I think those of we need to, as service providers, intentionally account for that time and just ease into it and ease everyone back to whatever the new normal looks like. Um, and I think a big thing, Eva mentioned that people are anxious about the skills that they learned and then haven't been using for a year and a half. And one of those big skills that we're hearing from teens and adults is the worry about having to relearn how to mask back in when they go back to community programs and in person and stuff. And that's an alarming thing to worry about because they shouldn't really have to be masking in the first place. But we know that there's going to be some crazy stuff in society that's going to expect that. So giving time to navigate that and safe spaces to kind of provide those transitions so that anxiety, so somehow we can reduce that anxiety going back to this normalcy. So we're hoping that advocates and self-advocates are really going to be open with us and let us know what they need so we can provide the best spaces for those transitions. And like I said before, we're really hoping to make sure that these remote options stay accessible and still available as we move forward. Where are we for time? Cool, 12 o'clock.
And I think part of what Dr. Nicholas was talking about is that fatigue that's happening right now with the whole pandemic. And unfortunately, we're not done yet. We still need to focus on staying healthy and getting ourselves through this as vaccines roll out and thinking about what our role might be in terms of, are we going to be going for vaccines? Are we getting it? How are we going to move through that whole issue? And then what does staying healthy mean? It did seem that at the beginning of the pandemic, people had a little bit more energy devoted to what that could be. But after a year, it just seems like it's difficult to continue. And we really do need to focus on those things like our self-care, our eating habits, our sleeping habits, exercise, getting outside. We really find specifically with many of our participants that when we offer opportunities to be outside and socialize together, participants are really jumping on those opportunities. That connection piece is really important, especially after the fatigue of connecting online. That opportunity to connect outside and in person and be safe is important to so many people, because so many people are adjusting to the pandemic in their own ways. So being able to provide a really safe way to connect, we find has been one of the most important things that we can do. And it was a tough winter, that's for sure, especially when the temperature dips. So the minute that the weather started to improve and we were able to meet outside again, it was just something that was so valued by a number of our participants. It doesn't work for everybody though, and that's just an important piece, is really trying to find those smaller ways to connect with people where, you know, the online doesn't work, right? The in-person really doesn't work, or the challenges with masking or wearing a mask, or the PPE, for example, or understanding distance. Some of the things I've heard from families is, you know, they've been quite proud of participants that have been able to learn something like wearing a mask to cover their nose and face, but being concerned that the participant didn't necessarily understand why they had to do this or how long it was going to last, but yet still being able to forge ahead and learn that skill. And there's been so many of those examples in our community of individuals learning something new for the pandemic, just as Dr. Nicholas described as the silver lining. We've seen a lot of silver linings. And we're looking for ways to keep those up during this time of kind of fatigue. You know, we've heard from families that have use some of those resources that were described, things like social stories or trying to understand the pandemic from a different perspective, really focusing on rest, relaxation, learning something new, learning a new hobby. But really, as my quote really brought home earlier, is that real need for social connection. And I think sometimes we might mistakenly think that individuals may prefer being online, when in fact, really the research pre-pandemic and during the pandemic is showing that the preference really is more still for face-to-face interaction. So having as much of that possible during this time, especially as we move through this, is just really something we're working on trying to make available for our participants. One interesting piece of research was really that resilience piece was really associated with staying hopeful and having hope for the future, and finding and working on ways to develop that feeling of hope, whether it's, tomorrow will be better than today, or the pandemic will end in however many months, or the vaccine is rolling out, whatever it takes for individuals to feel that hope again, really adds to their ability to be resilient and to move through this pandemic. And like I said, we've seen so many examples of that just amongst our community of individuals who are working so hard to find that silver lining and to focus on something positive, even through the challenging times. So it's been really, really wonderful for us to see our participants learn and grow. Honestly, we are going to look for ways to maintain that, look for ways to do better. It's just been a learning experience for everybody. I'm just getting a message that we're about to end here.